So it is my great pleasure to bring together everyone out there and Dr. Kinal Bhatt, correct?
Mm-hmm. That is correct.
Yeah.
Yes.
And I am actually going to have her share with you both her title, a little bit about herself, and what it is she does. Because those three things all come together into a package. But the reason she's doing this courageous conversation is a combination of who she is, what she does, and why she does what she does. So I'm going to turn it over to you for your response.
Thank you so much, Tika. I really appreciate this. So just a little bit about me, Dr. Kinal Bhatt. I'm currently the Regional Medical Director at Life Molecular Imaging. I am one of the several what we call medical science liaisons across the nation. So we have about 6 on our team right now. I happen to be in the Southeast region, currently located in Miami, Florida. As I was telling Tipa earlier today, my role as a medical science liaison is to be the educator as well as be that anchor for my company, where I get to have the honor to talk to people like Tipa and many others so that I can bring the intel that they have by directly speaking to their patients and caregivers and give us those notes as far as what it is that our medical community or our patients and caregivers really need to know, what knowledge can we bring to them, as well as what we can learn from them, so that our science can be better. We are a diagnostic company. So what we do is we have tracers that help diagnose Alzheimer's disease using amyloid and tau proteins or PET scans. And where do they fit in the clinical pathway of Alzheimer's disease and some of the other neurological disorders, but also where is the knowledge for dementia experts, non-dementia experts, patients, and caregivers. So I'm super excited to have this opportunity.
So I'm going to unpack this a little bit, because what she shared is, wow, boy, does she have a job and a half. Because she's with a company that is on the cutting edge of helping us better appreciate and understand what's going on inside someone's brain, living brains, might I add, brains that are alive, and understand what is happening chemically, among other things in there, that helps us better appreciate this thing called dementia when it comes up. But when I say we're talking about from that scientific group that's doing research stuff to the clinical group that's got the job of serving people who are developing different forms of dementia, who are starting to show symptoms or maybe not show symptoms yet. And then to help the families and the people who are living with these different situations really appreciate what it is this imaging does or does not do, and what it might or might not be able to do as we learn more and more about it. Is that accurate, or am I off on that?
That is absolutely accurate. You could not have put that any better. I mean, my role as a liaison is exactly that, connecting the dots between researchers who are doing the bench work, clinicians who are seeing patients, advocacy groups who are talking to caregivers, and how do we bring them all on the same table? So very well said. Thank you.
Hey. So one of the things that I know, because we actually learned about one another through the support. Excuse me, so sorry. One of the things we did was learn about each other through the Naples Alzheimer's Support Network, which is Clark Pollard. And Clark and I have done work for a long time, but we're supporting people living with dementia, their care partners. And, you know, it's a large community there, but we also partner on an international scale. And so we are working a lot with people who are pre-symptomatic, symptomatic, living intensely with this. But we're talking about a whole range of conditions related to dementia. And particularly, it sounds like for right now, you guys are focusing on beta amyloid plaque and tau pathologies for the development of Alzheimer's disease, that particular dementia. But as you're doing that, I'm thinking you're also trying to sort out what is not. What is this not? Is this not fit here, or does it? Because again, this is as I said, cutting edge area. And so helping us learn that having different things happening chemically doesn't necessarily translate always into what I can or can't do with my clothing, with my body, with my day, with my ability to drive a car. I mean, it's related. I'm curious, is it always a one-on-one correspondence, or is there some like missing stuff here in the middle that we're trying to figure out?
Sure. First of all, thank you for bringing that conversation in where you differentiated dementia from Alzheimer's disease. So that's the most baseline information that we certainly want everyone out there to understand, that when you say dementia, you are not necessarily saying Alzheimer's disease. Dementia is a symptom. Alzheimer's disease is a diagnosis in itself. So thank you for bringing that into this conversation. And of course, you're absolutely right. Yes, our majority of our focus right now is on Alzheimer's disease. We do have a big pipeline of other potential diagnoses at Life Molecular Imaging.
Oh, did you see me do that? I don't want you to miss
that.
Yes,
I did. I probably should have mimicked you together. Yes. So,
yeah, and why are we excited about that? Because I'm going to pause this there for a second, because
absolutely,
I really want it to be real evident. Alzheimer's is one, but heaven knows we've got like so many other dementias that could use this same kind of rigor and this same kind of appreciation. So say a tiny bit about, these other quote unquote, and I'm not even going to say and related dementias, because I don't know that all of them are related. That's not my understanding. They're all not all related to Alzheimer's, but they are other dementia related things.
That is correct. And, I'm going to probably take even one more step back and say, when you start complaining about memory loss as a patient, when I go to a physician and you complain about memory loss, what is the first thing that a doctor does? That a physician or a clinician or a researcher is going to rule out, is there a vitamin deficiency? That's plain rule. They will probably order an MRI to rule out.
Is there a mass?
Structural components to this. When you rule out all of those basic potential possibilities, then we are starting to look into, is it amyloid plaque? Is it tau plaque? What's the progression of the disease? Then we're, not just based on, we obviously have the cognitive tests that also play a big role into letting the clinicians know what other potential diagnoses they may be looking at. So all of this is a combination of many different rigorous tests that a patient goes through before we can tell them, is your memory loss related to Alzheimer's disease? Is it related to Parkinson's disease? Is it related to vitamin deficiency, structural issues, Huntington's disease? I mean, it's a big spectrum, frontotemporal dementia, Lewy body dementia. I mean, you name them. We need these several different diagnostic tests to determine accurately what the person's diagnosis is so that we can correctly treat them.
Yeah. And so I'm going to add this one little twist at the end, which is we do the cognitive test, but then we have to ask the question, so how is it impacting their life? Because when we're younger, our cognitive tests, those are really important cognitive tests because they tell us how we might do in math or how we might do in social studies or English, and so that's one of the reasons we do cognitive testing. But, sometimes people surprise us and it's like, wow, I wouldn't think she'd be that good at math, but she is. And so the idea that we need to be careful that when we get a cognitive like whether it's a mini mental or animal fluency or a neuropsych eval, that does not always translate into the currently held, definition of a dementia is when you can't live your life the way you were living your life due to cognitive impairment, which is sort of like a hard definition. Like, so if I give stuff up, that means I don't have dementia. If I don't do it for a while, I'm not missing it.
Very great points, because you don't necessarily have a memory loss because it's related to any types of dementia. This could very well just be age-related memory loss. It's not undermining the place of cognitive testing in the clinical pathway of diagnosing somebody with who presents with memory loss. But at the same time, recognizing that all of these different testing really do play their own unique role.
Yeah. Oh, and we didn't even mention depression and anxiety.
That's correct. Thank you. That is correct. Yes.
Because again, those other things, or stress of doing something and not realizing how many, or we did talk about sleep, I think, but that idea of how our lifestyles can matter. So, but I want to get a little bit further into your role and the work that your company is doing, because I heard some really specific work that, we currently, one of the reasons historically that PET scans were not reimbursed by Medicare, by some other third-party payers, was that, well, so what? What are you going to do differently if you get a result that says, it is this and it is this, but what are you going to do differently? Because they're still going to have this and it was sort of a nihilistic sort of approach to this. But for some families, knowing what's going on in the brain, even if I can't treat it differently yet, but knowing sort of where the damages are and where the functional areas are, for many people who are trying to live day to day with these things, can really, for them, it feels really different to be knowledgeable versus it's a black box and I don't know what's in the black box.
Absolutely. And I know very well this is a very multi-layered question, and I will try or I should say not even a question, a conversation. So I'll do my best to at least give you my perspective on this. It is extremely crucial that, our policymakers and our researchers and our clinicians, and of course our patients and caregivers understand how important it is to have that answer why. Not having imaging reimbursed at the moment, it most certainly makes this need very difficult. You would think that this should be very accessible. It's a very basic baseline test that we need to provide to our patients. Of course, there are a couple of things that are underway. One of them being, we do have blood-based biomarkers and there's extensive research that's being done. We're closer than we were yesterday as far as knowing the answer, how blood-based biomarkers will play a role in it. So we don't want to undermine that research. Most definitely, hopefully, soon enough. PET images can certainly be a little bit more expensive, but they're so crucial when doing the differential diagnosis, because those tracers do have uptake in different parts of the region. Time will tell how these different biomarkers will play their own role. Hopefully, having something that's more affordable will certainly help patients out as far as who then still needs to be imaged. At least that's the hope. Of course, people like you, all of us together will have to continue to raise our voices and let our policymakers and researchers know that we cannot, perhaps should not, and this may be harsh words, but we should not deprive patients of what they should have access to when it is here. Until, of course, we have that answer or reimbursement indefinite, there's a lot of reliance on clinical research. There are studies like New Ideas, which is sponsored by American College of Radiology. And there are many other studies that do allow patients to have reimbursed baseline image, at least the neurosig image for studies like New Ideas, so that they, or I should say amyloid image, my apologies, so that they have that baseline answer. But yes, there's a lot of reliance on research studies until the reimbursement comes in.
Hi, I'm Teepa Snow, and you just found our YouTube channel and watched one of our videos. I'm the owner and founder of Positive Approach to Care. Thanks for watching, and if you liked, if you have a comment about, or you would, please share it with people you know. Oh, and if you haven't yet done it, consider subscribing. We'll let you know when the next new video comes out, and you might want to visit our website, www.teepasnow.com, where you'll find other resources as well. See you there.